it can feel quite lonely not having anybody that actually understands. I felt like it was just me out there. But it showed me what I actually want to do, which is to help others, especially others dealing with chronic illness. My name is Charlotte Hall-Coates. I'm a youth engagement coordinator. One of my main programs is a summer camp, Camp Got to Go, which is for very unique and special kids. These campers, they normally don't get the opportunity to go to a typical summer camp. This camp is designed with their needs in mind. My goal for camp is have our campers leave camp with a greater sense of confidence, and also to have had them create these relationships and these connections with fellow campers, connections that they can now take back into their everyday lives and hopefully not feel so alone.
She was an adorable little girl. My name is Susan Hall, and Charlotte Hall-Coates is my daughter. Determination was evident from the time she was an infant. She stood up and ran at 9 months and just didn't ever want to stop. When she learned how to do a cartwheel, that was her main way of getting around. It was very sad to see her life get so small.
So my first year of university was a totally new experience. Prior to that, I've always lived at home. On the one hand, I was independent, which for a young person is exciting. You have this freedom, but it was also hard. It was also scary at times, not having mom and dad there to walk you through everything. I just woke up one morning with this sharp pain sort of in my lower abdomen. It hurt no matter what, whether I was sitting, standing, walking, running. I didn't really know what it was, so I left it hurting for a while. It took a long time for me to be like, okay, this is serious enough that I need to tell my mom. And then, of course, once I did, she was like, go to the hospital, don't be ridiculous. The tipping point for me was I had this my last paper of the semester before heading into exams, and so I couldn't think about anything other than getting this paper done. And I remember just typing away my final essay in pain. I think I knew something wasn't right. And as soon as I went to class, handed it in, I sat down and just started crying. I think it was myself saying like, okay, that's done, now you can figure it out yourself. And it was just like a huge wave of emotion. And then that's when I was like, you shouldn't live like this. Like, something's going on, something hurts. You need to go to the hospital. I knew that I couldn't do this alone, so I actually remember texting her from the bus, trying to think about how I was gonna broach this. And I remember her response was really meaningful to me, because she just was like, yeah, let me put on not pajamas, let me put on street clothes. And that really resonated with me. Had anybody like questioned it or been like, oh, why do you have to go to the hospital? That would have just made me take a step back. It helped actually go to the hospital. By the time I get to the hospital, I'm actually running quite a bit of a fever. I explained the pain. They were already doing blood work. They were already talking to surgeons. It all happened really quickly. But I remember a couple people asking, oh, do you have a history of Crohn's disease? And I remember looking at my friend, us both like scratching our heads, being like, what's that?
The thing about Crohn's disease is that it can be anywhere in the gut. Gabor Kandel, I'm a gastrologist at St. Michael's Hospital, also with the University of Toronto. Charlotte Hall-Coates is a patient that I know well. The most characteristic feature, I think, is pain, but it can give you diarrhea, rectal bleeding, vomiting, even difficulty in swallowing. There's probably no symptom referable to the bowel that Crohn's disease can't cause.
It was pretty devastating news. It's a terrible time of your life, I think, to find this out, because she had the stress of finding out she had a chronic condition, along with the stress of trying to get your university education and still have a life.
It can be very uncomfortable talking about the symptoms of Crohn's and colitis. It's a very personal disease, or one that you experience by yourself. So a lot of the times you are suffering alone. It is quite challenging when no one that you know has had to experience Crohn's. It's hard to find someone that really understands. So one good resource was Crohn's and Colitis Canada. That was sort of where I met the first people that had these diseases, and really was the first time it underscored that I wasn't alone. Sorry.
It stays with you. It's a chronic, lifelong condition. So that's very troublesome for young people, because when they look ahead, they worry that their Crohn's disease will interfere with their professional life, with their social life, with their ability to contribute to society, and really their ability to achieve happiness in life.
I'm Angie Spesic, Vice President of Marketing and Communications from Crohn's and Colitis Canada. For many people with Crohn's or colitis, it's a long process to get to a medication that works for them. All of a sudden in their life, they have stability, and they didn't have that before. They might have been having issues at the workplace, in school, and getting to a process where they have medication that actually provides some stability can make or break their life. The best part of my job is talking to patients that have the disease and being able to get a sense for what they're going through. Having someone like Charlotte as part of our team means I don't have to go very far.
Charlotte's a good example. Because she has Crohn's herself, she can really relate to the kids and understand what they're going through. So I'm Dr. Tony Otley, and I've been involved with the founding of Camp Guts and Glory, which is now also called Gut to Go. When they come here and they know that they don't need to worry about what is Crohn's disease, because the other kids get that. They have to take regular medications, or they're on tube feeds, or they have an ostomy, and they can just enjoy being kids.
A great example is from one of our campers from this year, Melissa.
Have you ever done this before?
Like one time.
Okay. I'm Melissa. I've been coming here for a whole 6 years. I used to have an ostomy bag for 1.5 years, which is the bag on the side of your stomach. But here, I didn't have to worry about these people seeing it, because they know. I was able to swim in the lake. It gets pretty emotional sometimes. That night was the first time I cried at camp. It helps quite a bit, just letting it out to somebody who understands, and you don't know how much you appreciate normality until it's gone.
So the journey to get to that stable spot in your life, it does take some time, and it wasn't something that happened overnight, and it's something that's difficult to measure, but I think finding a really great health team can really help you achieve that. Finding the right gastroenterologist that's working on your behalf, finding the right medication, finding the right clinic or hospital, and also finding your right support team, I think all help on your road to hopefully remission and recovery.
Hi there, Charlotte. How are you?
I'm good.
We have treatments for Crohn's disease, thank God, and actually the treatment of Crohn's disease has significantly improved in the last 15 years. It's really been a paradigm shift. But I don't want you to think that we have curative treatment for it. We can control it, but we can't cure it.
For me, this makes me feel better, so I look forward to having it done. It's something that I know and can rely on right now, and I think that's really important. The possibility of having to switch medication would mean that I'd be bringing up a lot of uncertainties. Everything that I find stable in my life could change. So it's the large things will I start having symptoms again? Will I have a flare-up? Will I have to go to the hospital? But also all the smaller things. Will I be able to take that vacation I'm planning? Will I be able to keep my job? Will I be able to live my life?
A lot of concern, both societies of patients and doctors with a special interest in Crohn's disease, is that because the cost is lower, they'll be forced to switch from the expensive drug to the less expensive drug. To me, it's so logical that if someone has a serious disease, which if not controlled causes serious consequences, there's really no compelling argument to switch a medication.
I was obviously concerned not only for myself, but also for everybody facing this uncertainty, and especially working with the camps. You can't help but think of the campers and how this will impact not only their lives today, but also what that means, in the future, and how that will impact their health.
We're talking about kids and teens that have decades ahead of them with their health condition. So having somebody else dictate about which medications can be used when we've already established a stable point in the management for that patient, that's not something we want. That's not something the families want to have happen.
I know she worries, but I think she gets up every morning and cartwheels to work and runs through her life like she did when she was a little girl. I love the fact that she can be such a good role model for children who are beginning to face this problem that they're going to have to live with. She helps them see their lives into the future as something that can look very normal and have few limitations.
I think having my own experience with Crohn's disease has really made me realize that this disease is really hard for anybody. I was a young adult, I was independent, couldn't imagine having had to deal with that when I was younger, when I was still in high school. Being a kid or teen is hard enough already without chronic illness, so I really just wanted to find a way to make life a little bit easier for them. I want them to not have to go through, some of the things that I did. I want them to just have an easier, better life.